Assalamu alaikum. My name is Sharjee and the topic that was assigned to us was pulse oximetry. So first of all, we will try to look into the history of the oximetry, and then we will see what pulse oximetry is, what are the uses and purposes of it, how it works, and what are the precautions and risk of pulse oximetry. So first things first, history of pulse oximetry. Pulse oximetry was invented in 1935. Matthias is known as the father of oximetry. However, first pulse oximeter was developed in 1972 and it was commercialized even years later in 1980. So what is a pulse oximeter? A pulse oximeter is a device that is used to measure the oxygen saturation levels in a person, or you can say in simple words the amount of oxygen present in the blood, specifically in the arterial blood. So it can is also used to measure the heart rate. So these are the two advantages of or the uses of pulse oximetry. We can measure the heart rate and the oxygen saturation levels. So what are the purpose, why do we use the pulse oximetry, why do we need pulse oximetry? So using pulse oximetry we can monitor the health of the person whose blood oxygen levels are affected. For example, in case of lung cancer, asthma, heart attack, pneumonia, mm, pulse oximeter is used to check the oxygen levels in the patient's blood. So let me give you an example. For example, when you go to an hospital and you see a clip-like device attached to the patient, so that device is the pulse oximeter, and we will also see how this works. This device consists of four components. First one is the biological variable, second one is the sensor, and third one is the integrator, and fourth one is the output. So what is a biological variable? Biological variable is the percentage saturation of hemoglobin molecule in the bloodstream. Oxygenated and deoxygenated blood have different light absorption characteristic depending upon the wavelength. And sensors, so what does the sensor do? On the sensor there, on one side of the sensor there is a light emitting diode, and on the other side of the sensor there is a photodiode. The light emitting diode emit the monochromatic red light and the monochromatic infrared light. So why particularly these two? Because the oxygenated anti-oxygenated levels have specific light absorption for these two wavelengths. Okay, so from the light emitting diode, light is emitted and pass through the tissues and pass through the finger, and it is absorbed in the tissues of the body, and the one that is not absorbed is um, emitted, is transmitted into the photodiode, which measures it and transmits and processes into an electrical signal, and that electrical signal is then converted into a numerical value which is shown on the monitor. So this I try to explain it in the simple words. You can watch more videos which will explain that briefly and you will understand it even better. So I tried to give my best. So what are the precautions that one needs to keep in mind while doing the pulse oximetry? Okay, so first thing first, the fingernail must not be covered with the nail polish, and the person's movement must be minimized. If you are moving, your heart rate will increase, and definitely that will affect the reading, and your temperature can also affect the reading because it's heat. Okay, and what is up to what level of accuracy we can measure these readings? Uh, it is pretty accurate. We can measure up to 2% of accuracy. If the reading says it is 92%, so yeah, original reading must be between the 90 to 94. The normal ranges of the pulse oximetry is from 95 to 100%. If it falls below 90%, this condition is known as hypersemia. The not enough oxygen is provided to that part of the body, and patient must be taken care of. So that is all from my side. I hope I have given enough, and but nothing is enough at all. So thank you so much, and let's see how this our semester ends. I'm pretty hopeful this goes well.